you, or am I looking?
All right, thank you so much. We are here with one of my favorite people, somebody who is an advocate for children from the American Academy of Pediatrics, Dr. Deborah Greenhouse, pediatrician extraordinaire. Thanks for being with us today.
Thank you for having me.
Now, today's been a very busy day for you and the folks at the American Academy of Pediatrics. You were at the State House today talking to lawmakers about what is so important and what is needed to keep supporting the children of South Carolina.
We were there today. We had pediatricians from the community, pediatricians from our teaching programs, pediatricians in training, all there trying to let folks know what is important as far as keeping children healthy, keeping children safe in South Carolina, and the things that need to be priorities going forward.
I know one of the things you wanted to talk to lawmakers about today was mental health and the rising frequency that you are seeing at your own practice of young kids having mental health problems here in our state. Why do you think that is, and what do you think can be done about it?
I think it's multifactorial. I don't think it is all related to COVID. I know some folks think that, but this predated that. These problems started well before the COVID pandemic started. I think there's a lot of things. I think social media plays a huge role in it. I think the pressures on kids in school play a large role in it as well. It's a tough time to be a kid right now, honestly. And then there's simply not enough resources for the children that are struggling.
Why is it so important, and something that I know American Academy of Pediatrics wants, is for schools to put more of an effort on and have more funding for mental health?
Absolutely. School-based mental health systems and programs benefit everyone, because if the child can receive the mental health counseling or treatment that they need while they're in school, the parent can stay at work. The child isn't missing anywhere near as much time from their educational activities. It's a win-win for everyone. So having as much of our mental health services as possible based in the schools, that benefits absolutely everyone.
Something else I know you guys were talking about today with lawmakers, and this statistic still floors me every time I hear it. 1 in 5 children in South Carolina experience food insecurity. I can't believe we're still at that number in 2025, but what do our pediatricians want to see done about it?
There are numerous things that we need to see done about it. I would say probably the number one thing is for every child in South Carolina to have access to healthy food in school. And that should be universal school meals for every child who needs them. It would eliminate the stigma of the child who is getting free or reduced lunch. It would allow kids to not be spending their school day hungry. We have really solid data to show that children who get good healthy food every day do better in school. They academically do better. They perform better in sports. They do better from a mental health standpoint. Food is everything.
How do you focus when you're hungry? It's
can't
so hard.
even
How do you
imagine.
focus? You can't.
On the occasion that I skip breakfast for whatever reason, I'm an absolute mess by the middle of the morning.
It's so
you
true.
Can't do it.
Gosh, there's so much to talk to you about, but I want to get to this before we have to go to commercial break, because we've heard about the measles outbreak in Florida, measles outbreak in Texas, and I know there was an idea being floated around of not having vaccine mandates at our South Carolina schools. And according to the American Academy of Pediatrics, you have to have 95% vaccination rate for herd immunity. What is herd immunity, Dr. Greenhouse, and why is that something we have to hold on to here in South Carolina?
Herd immunity is the concept that if a high enough percentage of the population is immunized, that will help to prevent the disease from resurging, and it will help to protect the folks who are either too young to be immunized. In measles, with measles, for example, your children under a year of age, or those who simply can't be immunized for medical reasons. So again, measles is a live vaccine. So certain folks with immunosuppressive problems, cancer, things like that, can't get that vaccine. They are a sitting duck if measles gets into the community. So that herd immunity level, 95% is what is considered herd immunity for measles, is incredibly important. And the only way we get to numbers like that is to have real solid vaccine programs and to maintain good vaccine requirements in our schools.
Okay, so important. We know there's lots more to talk about here with Dr. Greenhouse. We're going to take a quick break, and when we come back, there's been a warning from the FBI about an online trend. Parents, you'll want to hear about it. That's next.